Joining us now is Dr. Robert Murphy. He's a professor of infectious diseases at Northwestern University Feinberg School of Medicine. Good morning, doctor.
Hey, good morning.
Well, it's a mild case, but he is 79 years old and has the best health care. How dangerous is this latest variant for someone like that?
Well, it's not so much that the variant is more dangerous, but it's just so much more contagious that essentially, as I'm sure you're aware, and you have friends too, everybody is getting COVID now. I mean, no matter how many times you've been vaccinated, no matter how careful you are, everybody seems to be getting it. And that's because it's just so contagious. The disease is the same. If you're older, you're at risk. If you have underlying medical conditions, you're also more at risk. But President Biden has had 2 booster shots plus his first 2 shots, and he's taking Paxlovid. So he's probably going to do okay. And that's the name of the game now.
Let's talk about COVID cases globally. They're plateauing, but deaths are rising. Is that everywhere?
Yeah, well, I mean, there are pockets around the world, but in general, Robin, it's like we've seen before. There's these waves. So it looks like we're peaking now in the current wave. For the United States, it's like the 6th wave. Worldwide, it depends which area you're in. It's like the 5th wave. But anyway, it's peaking. And so what we'll expect is that the numbers will start coming down again. And this is just going to continue because the immunity to COVID is not good. In other words, you're not protected. It's going to be like the flu. Every year you get a different flu shot. The same thing is going to happen with COVID.
Let's talk about monkeypox. It seems to be severe in Africa, not in other places. Should we be worried about the situation in Africa as it relates to spreading, or is that something completely different?
Well, what's happened now is in Africa, it had been primarily in these fruit bats and these animals and stuff, and it was pretty much remained there, and there were outbreaks, and the outbreaks would stop. But those people weren't as mobile as the people that got infected this time. So these originally people in the UK and then Spain spread in the gay community throughout the world, and now it looks like it's set in that community. So it's not typically a sexually transmitted disease, but it can be transmitted with any kind of intimate contact. So it can jump out of that community. It can jump into animals here, or it can jump into other populations. But it looks like the cat's out of the bag because, they now are reporting over 13,000 cases worldwide, and it is grossly underreporting because it's hard to get the test, and almost 2,000 here in the United States. I think pretty much it's going to be endemic here.
We heard about a case of polio popping up in New York. I thought that was wiped out. And I mean, can a disease like that have a resurgence through the unvaccinated?
Yeah, that person had traveled not too long ago to Eastern Europe, I believe. And the strain of polio that they have is actually the polio you get from the oral polio vaccine. So he got infected from somebody who had had the oral polio vaccine. So how that happened or whatever, we don't really know. But doing the genetics of it, that's what it looks like that case is. So now, of course, is he going to spread it, whatever? Probably not. But, they're going to keep an eye on this case because we haven't had a case here for quite a while.
Right. Okay, Dr. Murphy, thanks for being with us. Doctor answers your questions Tuesdays on Northwestern University's Institute for Global Health Facebook page. You can submit questions by Facebook message or via email, and you can also check out the Explore Global Health podcast. Thanks, Doctor.
Thanks, doctor.
Thank you. Have a great weekend.
You too. Hey, Paul.